Hello, differential diagnosis team or differential diagnosis students. This is Dr. Kamel and the new NPT style questions. So let's go and see this question. A physical therapist performs a chart review of a new patient and finds the patient is positive for the Heliobacter pylori bacterium. The therapist should anticipate that the patient presents with which of the following medical conditions. Okay. Somebody may say, "Oh, uh, why that? We are physical therapists. We are not supposed to know about different types of bacteria, what bacteria causes what, and so on." No, but now the NBTE is trying to ask for or check the knowledge of physical therapists in pharmacology, in pathology, and pathophysiology. Why? Because as a physical therapist, we are supposed to have like direct access for patient. So that's why even in our course, we try to do like screening for patients to know. So no, this is not out of scope for our knowledge. There is out of scope for knowledge and out of scope for practice. Yes, we will not be treating Heliobacter pylori bacterium, but at the same time, we need to understand what's meant by that. Okay, and bacterial infections in general can be harmful and potentially life-threatening if left untreated. So, if you suspect that a patient has bacterial infection, for example, starting in muscles, later on it could lead to further complications like osteomyelitis, like different complications. We need to be aware of that. Bacteria will multiply and utilize nutrients for its host, so produce direct tissue damage and and produce an immune response which can lead to harm the host. Who is the host? The patient. Specific medications are used to treat bacteria based on their classification and microorganisms. Okay. So let's see what is the correct answer for that. Let's explore the options we have. We have four options. First one is meningitis. What is meningitis? Itis here means inflammation. So what is meningitis? Meningitis is inflammation of the membranes surrounding the brain and the spinal cord. What is pneumonia? Pneumonia is a pulmonary problem or chest problem, and refers to what? Refers to inflammation of the lungs due to could be bacteria, could be virus, could be fungal infection, could be parasitic infection. Gastric ulcer disease is often caused by gram negative Heliobacter pylori. Sometimes so could be this answer. Okay. What is tetanus? Tetanus is an acute and often fatal disease if left untreated, marked by what? By a state of continuous muscular contractions and rigidity of the voluntary muscles. So the correct answer is 3, which is gastric ulcer disease. So, as I mentioned, that gastric ulcer disease is often caused by gram-negative bacteria, which is Heliobacter pylori, this bacteria, and is found where? In the upper gastrointestinal tract. This infection is believed to be a potential cause of gastroduodenal ulcers, so it can lead to ulcer also. Gastroduodenal, the duodenum is part of a small intestine, and gastric means stomach. So the connection, gastroduodenal ulcers, and must be treated with antibiotics. It is treated primarily with amoxicillin or clarithromycin. So two types of antibiotics mainly, and may be combined with other medications to enhance the healing process of any ulcers that are present. Let's look at the incorrect options or answers. As I said, meningitis is inflammation of the membrane surrounding the brain and spinal cord. The meninges, we have three types of meninges. We have the bia-arachnoid and dura mater. There are multiple forms of meningitis, and multiple bacteria can produce meningitis. One of the famous bacteria to be known to cause meningitis is Neisseria meningitis is one of the bacteria that is leading cause of bacterial meningitis, and mainly it is treated with penicillin G. Pneumonia is inflammation of the lungs due to bacterial, viral, fungal, or parasitic infection, and the most common bacteria is mostly community acquired pneumonia, which causing community acquired pneumonia is Streptococcus pneumoniae, which is a gram-positive bacteria. It is treated primarily with penicillin, ampicillin, and if the patient is penicillin resistant, they use vancomycin, which is another type of antibiotics. Tetanus is, as I said, acute and fatal condition if not treated, because it results in a continuous state of muscular contraction and rigidity of voluntary muscles, most commonly caused by bacteria Clostridium tetani, and is treated by penicillin and vancomycin. So this is the end of the question for today. Hopefully to see you soon in another question. Good luck in your studies and best wishes. Thank you.